Hey everyone, David Holt here with the Medical Entrepreneurs Blueprint podcast, the podcast which is designed for med spa owners and healthcare entrepreneurs as they start and grow. Why would I hire a, ugly skinned attorney, right? If he's not actually, on board with the med spa business.
Just seeing that people's lives can be changed, like hearing them tell me that I've changed their lives or like turned around their health is extremely rewarding.
Well, darn, it's not about cute pictures. I'm doing it all wrong.
And now, the Medical Entrepreneurs Blueprint podcast with David Holt.
Hey everyone, David Holt here with your first episode of the Medical Entrepreneurs Blueprint podcast, the podcast which is designed for med spa owners and healthcare entrepreneurs as they start and grow. I'm healthcare attorney David Holt, licensed for 10 years in Minnesota and recently expanding to California. Our law firm focuses only and specifically on healthcare business owners. And so what I want to do is take a lot of the expertise I've learned over the past 10 years and give those to you on these podcasts. All right, so you're probably wondering, why is there such a boom in the med spa industry? I think there's a number of reasons, both supported by data and then also based on my experience and opinion. First, I'd say that medical technology has advanced significantly over the past decade. And what this means is that whereas 10, 20 years ago, Botox, everybody thinks of Botox when they think of a medical spa. But now, today, with medical technology, there are new machines. There are very nice machines that have less pain for patients that are coming out on a monthly basis. And so the competition in the industry and also the results have increased as well. And so with that, I think it's more appealing to a patient, especially somebody like me who has a very low pain tolerance, to go and try and get a procedure and not have pain and have maximum results. So with that, I think that's one of the bigger factors for why the med spa industry is booming. On top of that, I would also say that health awareness has risen significantly. And with that, in kind of the post-pandemic, being more cognizant of our mental health, how we look, and having sat in front of a Zoom camera for, 3.5 years and looking at every little wrinkle and every, thing on our face, I think that there's been more of an awareness of how we look. And I think that that can be done also in a tasteful manner, right? I think there's probably everyone's tolerance for what they want to look like and what's a genuine part of themselves is up to them. At the end of the day, though, we're all aging, and the technology is out there to look better on a Zoom call, is what I'll say. Finally, another factor for why this med spa industry is booming is access. So if you look at 10, 20, 30 years ago, you think of Botox again. Generally, this is something that was very taboo. Maybe actors, celebrities would do this, those who wanted to look good into their 50s, 60s, what have you. But now, medical procedures, with the medical advancements and just more of an awareness that procedures are available and less of the taboo around them. I don't think we hide as much as we used to. I think with social media, I think there's been just a pouring out of vulnerability around men, women, whoever, getting medical treatments and sharing their experiences and just being open and honest about them, which then leads to curiosity and other people who didn't know about a procedure going and getting it. This has all created access as in awareness, and through costs going down, there are more individuals that are actually getting those services. And so this is what has really led to an increase in the medical spa industry. And to be honest, I think that the industry is just getting started. If you look at some of the gains over the past few years in the 2020s, this is a massive multi-billion-dollar industry, and I suspect it's only going to continue to grow as the technology increases as well. So with that, when you're thinking about this industry that's booming for medical spas, you need to also have a good understanding of the market dynamics, putting your business in those market dynamics for success and expanding in the industry. I think there's a lot of options for things that you could do. Generally, when I'm working as an attorney for some of the medical spas, one of the biggest things I start with at the very beginning is the consent forms, patient consent forms. And I see a lot of business owners that want to do lots and lots and lots of medical procedures, and that's great. But I always ask, what would this mean if I was just a patient coming in? It seems like a lot of options, and they don't really fall into their own category. With that, as I'm starting to hint at patient intake forms, let's talk about the legal considerations for the medical spa startups and how it would look like for legal tools for growth. First, what I want to talk about is the key considerations when you're picking your initial entity, right? So I'm a medical spa. What's confusing about medical spas is there is no medical spa law, at least in Minnesota and in many other states. And so there's not just this beautifully written law that I can go look at that says, okay, medical doctors, you can do that. Nurses, you can do that. And everyone else, you can do these procedures. It's actually very complicated. Largely what really happens is what a medical spa can or can't do flows down from the types of licensed professionals that they have, generally stemming from a medical doctor and then working its way down in complexity to other licensed professionals. This does not make it easy to start a medical spa, to be perfectly honest. The government or the rules that were written have not made it easy at all. And, why that is, I don't know, but it's important to know what exactly you can and can't do in terms of ownership, in terms of what procedures you can do, because if you are doing things outside the scope of practice, like I have no medical training, if I were just to go off and start doing Botox, that would not be good. Not only would I potentially be fined and sued by the patients who had damages, but I could also have the government, the attorney general, come after me for criminal misconduct. So that's staying within your scope of practice. All this to say, it's important to have a solid legal foundation. So the first thing that you got to figure out is just, can I even own a medical spa? That's question number one. Question number two, if you can, is what procedures can I specifically do, which are generally going to stem from what type of licensed professional you are. This is confusing because when you think of medical and spa, we kind of know what that means. Spa, I'm thinking, it's nice, it's, looking good, it's more cosmetic. When I'm thinking medical, traditionally only medical doctors were able to use that term, but we're certainly in more of a gray area of law for other licensed professionals and even sometimes unlicensed professionals being able to use the medical term, so long as it's not misleading to consumers or patients. But there is not, in Minnesota at least, an official license or permit to be a medical spa. It's all going to flow down from the medical professional. What this means is that most commonly we have groups of medical professionals, or even sometimes if you're using a cool tool called a management services organization, you can have completely unlicensed people be somewhat involved in the management and administrative services of a medical spa. And what this means is groups of these individuals could own the medical spa, and potentially another organization could be involved in marketing, answering the telephones, doing more of the actual day-to-day operations. So this is very confusing. I did not write the law, I just interpret it, but there is no medical spa law in Minnesota and in most states. For some medical professionals, when you think of, clinics or hospitals or assisted living, there's generally medical licenses that the state has that you go and apply for, and you submit an application, you go through all these policies and procedures, and then you're approved, right? With medical spas, there is no such thing. Rather, all of the authority to do procedures like Botox and lasering and microneedling and what have you is going to come down from the individual authority of a medical practitioner. So if a medical doctor can't do Botox, they can. If a medical doctor can't do a procedure out in their, regular medical clinic or at a hospital, that means at a medical spa, they would also not be able to do it. To further complicate things, what happens often with medical spas is you can delegate your authority. So you'll see this sometimes at hospitals. It feels like the nurses are doing everything, and then the doctor just kind of like a dentist too. You go into a dentist's office, you're getting your teeth done, and it feels like the poor dental hygienist does everything, and then the doctor comes in, tells some jokes about it, makes you feel good, and checks the work and then leaves. Somewhat similar in the med spa industry. This is just how the business works. And so what happens is you can actually delegate authority from a medical doctor, for example, down to traditionally a registered nurse. In the hospital, you'll see this all the time, where the registered nurse is the one coming in, administering medication, doing a lot of the moving of the patient's meds, and the doctor will come in shorter periods, make sure everything's on track, and maybe high-level decision-making, but not actually doing a lot of the work. I know I'm going to upset some medical doctors when I say that, but it's true. Go to a hospital, and if you've been in a bed, I think you'll find a similar experience. What that means for a medical spa is you need to have behind the scenes, so patients don't see this, the public doesn't see this. This is all the nice stuff that is set up legally behind the scenes, is a delegation agreement between the medical doctor or nurse practitioner or respective medical professional that can independently do a procedure down to who they're delegating it to. What's interesting is Minnesota is a state that does not require on-site supervision 24/7. So that means that, like in the hospital, there's the doctor, going around. They're physically present. They may not be in the room, but they're at least on the premises. For a medical spa, not required that the medical doctor is at the building. This is huge. This is huge because what this means is, if you've done it right from a legal perspective, you could have access to a medical doctor, commonly called a medical director. They could be off on a yacht, but readily accessible, and provide the delegation of their authority down to those, boots on the ground, generally registered nurses that are doing injectables, doing procedures locally. That is the legal landscape as of now. Now, I've oversimplified it because it's a podcast. This isn't direct legal advice on your situation, but with the right legal tools, you can set all of that up. Okay, let's switch gears a little bit. Let's talk about entity choices. Entity choices are always the first big question. Now, I'll just cut to the chase and tell you likely an LLC if you're in Minnesota. Specifically, we put a little P on the front, but that's optional. But likely an LLC, and specifically, because we're licensed professionals, a professional limited liability company. In California, likely a professional corporation. Now, I say likely because I'm not having a conversation with you. I'm not analyzing your facts, but based on simple statistics, both with my firm for 10 years, as well as you can pull up public data on the most filed entities based on actual classes of who is filing those, what types of professionals they are. It's going to be likely LLC and likely professional corporation in California. If you look also and you survey 50 states, you're going to see likely LLC. The limited liability company, fun fact, was not too long ago, about 30-ish years ago, and it was designed to have all of the benefits of the corporation, but to make it a lot easier for the entrepreneur, the small business owner, the rather unsophisticated, just getting started and didn't know all these corporate formalities and board structures and meeting minutes. It was a vehicle to have the protection of the entity, but make it a lot easier for that single member LLC, so a single owner, to administer. So likely LLC is what I always say for entity, but you should actually go through the steps and figure that out. Now, S Corp, everyone wants to be an S Corp. What's an S Corp? S Corp, my accountant said it, my friend said it, my, business colleague has it, and everyone wants it. I would say likely S Corp. What's a fun fact is that the S Corp is not a legal entity. It's a tax election. So for example, I am Holt Law LLC, but I am taxed as an S Corp in Minnesota. In California, it would be Holt Law PC, taxed as an S Corp. What that means is you go through your accountant or CPA and you make a little fancy filing with the IRS. They look at it, they accept it, usually, if you've done it right. And what this allows you to do is to pay less in taxes if you're doing pretty significant revenue. So that's why everyone says S Corp, S Corp, let's pay the legal minimum to the IRS. Totally on board with that. There may be limited situations when you don't do that. So talk to a tax professional, but I'm just playing statistics here. We're just playing statistics. And I'm going to say likely based on experience. If I were to survey my current client set or survey those that I work with in the industry, it's likely going to be an LLC in Minnesota and likely with an S Corp election. Let's jump now. We got the entity set up. We've decided if we're going to delegate. We've decided that whether we need a license or not, we don't in Minnesota because there is no med spa law. Let's jump into some of all of the crazy complicated healthcare rules that are out there. And what's interesting is when we're talking about patients, because there's still patients at a medical spa, even if it's elective, even if I'm coming in for Botox, you should still have a medical record. There's still a patient, even though they might be a friend. We need to talk about both federal law and state law. So there's HIPAA. Everyone kind of knows what HIPAA, although only probably 5 people, probably attorneys, have read the whole thing and actually know what it means. But we all think we know what it means. And when the medical providers have, breached, you have to comply with that. What's complicated in healthcare law is that we also read the local state Privacy Act. In Minnesota, we have the Minnesota Health Records Act, for example, which is read alongside HIPAA and protects patients and needs to be considered when you're drafting your notice of privacy practices. So all this to say, there are a bunch of rules behind the scenes that you need to know as the healthcare provider, the medical entrepreneur, to not only provide as a notice to your patients, but to actually follow behind the scenes. It's one thing to give somebody a big notice. It's another thing to actually know a little bit what it is and follow it. And so one of my jobs is to just take these massive, ugly laws and just summarize it down into the key things that you need and send you on your way without overwhelming you. All right. So got data privacy. Let's move on to some of the underlying legal documents. So biggest ones in a medical spa are going to be the patient-facing documents or the patient intake and consent form. These are the ones that the patients see, they go through it, they read. There's multiple layers to this. Just quickly, without going into them, there's going to ideally be a master patient intake and consent form, disclaiming your liability, talking about boundaries, talking about what happens if there's a dispute. In a perfect world, we'd have a specific intake for every procedure that we're doing. So if I was doing Botox, if I was doing microneedling, I was doing lasering, I would talk about all the things that the laser could, everything that could go wrong. And I tell the patient, listen, given all these bad things that could happen, do you still want to go through with this procedure? Heck yeah, I do. I want to look good. I don't care. And they sign and they probably don't read. In fact, if I had to guess how many clients and patients actually read all the documents that I have drafted, I would put that number at probably a low 2 to 3%. Not because I'm jaded, it's just because we don't have time, if you're actually being honest. If everyone in the world actually read every legal document that they were handed in a day, I think commerce would just grind to a halt. And hey, what does that mean for lawyers? I don't know. But okay, back on track. So we got our patient intake and consent forms. We got our specific consent forms for each procedure. We got the notice of privacy practices, like what I was talking before. Another couple documents we would need would be a telehealth consent form. We can do video, we can do call. Ideally, don't send a little picture on Instagram. We're going to keep it professional. So we're going to talk about what our telehealth rules are and what the local rules are going to be. Then, actually a relatively new law is the No Surprises Act. And this one's kind of fun for medical spas because what it means is you need to give your patients a fee schedule or let them know what the costs of services are going to be before they get the service. I feel like in most other industries and places in the world, it seems like a normal thing that you tell people how much things are going to cost before you actually get them. Medical care, if you've ever been to a hospital, you don't really know. And part of that is because, you go in and they got to kind of assess what's going on. It's kind of difficult to know exactly what to feed you if they don't even know if you're, what your dietary restrictions are. I don't know if that's the best analogy, but I get some situations, but for a medical spa, you should have a nice fee schedule, Botox, this amount, lasering, this amount, microneedling, this amount. This is going to satisfy your duties under the No Surprises Act. We also give them a nice little boring notice as required by federal law. Then me, the patient, I'm never going to argue that it's a surprise to me that is the cost, because I was given that in the intake documents. Also, I think it would probably be on your website. You'd run the credit card at the point of service. I don't think med spas, I have never heard of a single med spa client having an issue with the No Surprises Act. It's usually, the law was originally written to combat the surprise medical bills that hospitals often get away with. You go in and you think you're doing one thing, and then they transfer you to another part of the hospital, and all of a sudden you're out of network and you get a bill for $20,000. And you're pissed, as you should be, because never along the way does the hospital ever really care about, how much this is going to cost for you. In fact, I would argue that they're financially incentivized to not really care. But that's why I work for small healthcare providers and not big healthcare. All right, contracts. So that's just a high-level summary of what I would expect to see in patient intake and consent forms. There are, of course, a myriad of other things that are going to be specific to each situation, but those would be the top 4 or 5 right there. Now, here's where a lot of my clients get into trouble. I have had plenty of clients come to me, and they've already set up. They kind of, they made their way through things. Totally respect those who are more independent. I'm kind of a DIY guy myself. I'm learning to ask for help a lot more right now. But what I've seen is when you've gone the DIY route, there comes a point where things just get a little too complicated. And I commend those who call themselves out and then say, hey, listen, I think I got a mess. Can you come in and fix it? And generally we can as attorneys. It just becomes a little bit harder. It's almost as if you started your own medical procedure and you came in and you were already bleeding and you said, hey, surgeon, can you finish this up for me? It's like, well, you cut it the wrong way. And, what is that thing hanging out there? So it makes things harder. Always happy to talk to clients. I think the biggest issues that I see them get in trouble with before they come to me is they have unreviewed legal documents with vendors or other businesses. These could be software companies. They're generally landlord, commercial lease agreements. They are agreements with medical directors or these other organizations that kind of help the medical spa. And unfortunately, what happens is those agreements are drafted by attorneys who are purposely representing all of the interests of that business and none of the interests of the medical spa, as they should be. That's the attorney wouldn't have been doing their job if they didn't draft it that way. It's your job as the medical spa owner to push back and get beyond kind of all the nice marketing, salesy language and, all these kind of things that are said but not actually, held accountable to, and have the attorney up front be reviewing those. Because after you sign that contract, there's not a whole lot we can do in terms of getting out of it unless there's a good termination clause. So better to invest on the front end in those reviewing and drafting those contracts on the front end rather than being stuck on the back end and basically begging for forgiveness or looking for, any possible means to go through. What this sometimes means for clients is, I don't have a good legal answer. You're stuck in this lease for another 4 years. And yeah, you do have to pay that fee that you didn't really know about. And no, we can't exit out of this vendor. They're not really doing their job, but they have a provision in here that says, even if they don't do their job, you really don't have recourse. I think that's a terrible provision, but we don't have a lot to stand on here. Also, even if we go to litigation, so even if we fought this contract in a court, they have an attorney's fees provision down here that's favorable to them and not to you. So they have put in all of the legal tools to make it as difficult as possible to either get out or rearrange this contract. And now there's very little utility and value that I can add as an attorney. And it's frustrating. And, we have a lot of those calls and there's not a whole lot that I can do. I'm just very honest with our options. So investing in smart legal counsel, that's the moral right there. Let's turn to insurance and liability, kind of risk mitigation. So when you're starting a medical spa, as in starting any business, you should be thinking about insurance, right? You get a car, you got car insurance. You get a home, you got home insurance. Big assets generally come with insurance. What's interesting is there's actually, very little to no requirements across the US for medical malpractice insurance. But you would be silly to do that. It would be like driving around without car insurance. Probably not smart. Biggest thing, most important thing for a medical spa owner to get is going to be medical malpractice insurance. That's a no-brainer. But here's what they don't tell you that gets kind of confusing for a medical spa. When you're dealing with multiple medical practitioners, and what I mean by that is a RN and a medical doctor, what gets confusing is who we should write the policy for and who is actually the insured. It's not like a car where, hey, there's the car, write it for the car. It's actually, there's multiple cars and there's multiple passengers in the cars, and you got to make sure that the car insurance or medical malpractice insurance policy covers everyone and everything when you get into an accident. Now, what I do is I've just partnered with really smart insurance brokers that can figure this out and really dissect what it is that you're doing and how we've set it up from a legal perspective, and then layer on the medical malpractice insurance. Now, as the attorney, I'm supposed to tell you to go and buy about 40 other types of insurance, but I think I'm also a business owner myself, bootstrap my business from nothing. And with your proper risk tolerance, you might just get medical malpractice and call it a day. I'm not saying that that's the right thing to do. I'm saying it's a business decision that you can make. And when you're thinking about startup costs versus, just making revenue, getting your first few patients in the door, being able to feed yourself and your family versus, officers and, slip and fall and cyber liability and, business interruption insurance and all these other things, I think you need to make some cost benefit decision. So I'm not advising not to get other insurance. I'm saying first one I would get if I only had one policy to get would be medical malpractice, and written the right way to cover what we are actually doing with the entity. Outside of that, your biggest exposure from a legal perspective is always going to be down to the patient. I would say about 80%, from my experience over the past 10 years, of disputes and legal exposure is going to be down with the patient. So that goes back to the patient intake and consent forms. It also goes to running a smart business and having operations in place, good staff that actually do procedures well and know how to respond and properly communicate when there are issues or problematic patients that want more or unhappy with services. But outside of the 80% that's focused on the patient, I would say the other 20% in that bucket is going to be legal dispute-wise, and risk is going to be either improper legal foundation, and I'm just going strictly based on my experience and who's calling and what they're calling about and just breaking this down on numbers. So improper legal foundation, I have had many clients call, and unfortunately they had set something up. They'd read something on Facebook. They talked to a friend. They thought it was all good. They heard, this myth that this person could own the entity and they could split ownership. And lo and behold, they didn't get legal advice and have a, licensed professional that has, malpractice insurance to hold accountable for that opinion. And then they have the wrong legal setup. And I advise them immediately today, all the way back to when you started, you have legal exposure. So that's one of the things that fits into that 20%. The other, I'm just going to label as miscellaneous issues with your staff, so your employees or contractors, as well as those ones before with the landlord and your vendors. But really at the end of the day, and the whole reason we write these very expensive malpractice policies is for if you screw up on the procedure. And so from a financial perspective, from a legal risk perspective, when I'm setting up a medical spa from scratch, I spend a lot of time educating the medical spa owner on the patient intake and consent, largely because I am focusing kind of 80-20 on my own time using the 80-20 rule. 80% of our issues, 20% of the input is going to be on the patient intake and consent. Okay, cool. All right. So we chatted about the legal structure. We chatted about legal documents. Now let's talk about growth of the medical spa. Coincidentally, just launched a cool training for this, not legal advice, but a cool training, legal growth accelerator program on how to legally use legal tools to grow your business. What happens in healthcare, specifically in a healthcare business, what happens in the healthcare industry is we have a lot of rules, and a lot of them have very good intent. But when you read it and you are a medical spa, you say, okay, well, why is this even a rule? This is because a lot of the rules for healthcare providers stem from public payments, so from Medicaid, Medicare, so the government is paying for services, as well as physician-based legal and compensation schemes. And there's a variety of things that we can and can't do. Some of the buzzwords are going to be stark, kickback, fee splitting, referrals. So what I've tried to do in the Legal Growth Accelerator course for healthcare businesses is just outline, listen, here's what you can do. Here's what you can't do. Stop guessing and going on social media to try and get those answers. Here's the actual answer. And on top of that, I'm going to give you a usable something. Sometimes it's a script, sometimes it's a document to help you. The reason I'm doing this is because long-term, I want to see my clients grow just like how we're growing, because the legal issues when you're bigger and you have a solid legal foundation are fun and easy and are, things that we can, break bread and talk about and celebrate, as opposed to with a rickety, not solid legal foundation. We're really always just talking about a bunch of unfortunate outcomes, and it's not fun, and we're stressed out. And those are not the legal clients that I like to work with, because they're stressful. There's just not a lot of money. We're always cost conscious, which is fine, as am I, but we can't do things properly. And so it's like the old saying, which I should have picked out before I came, but you can buy the cheap set of boots and then just cycle through them like once a year, or you get those nice lifelong set of boots. You pay for it once, it costs a little bit more, but then you have that secure legal footing, right? And so the same holds true, I think, for the patterns that I've seen of clients that just can't get out of that first 6 figures, or for some of them, it's even 7 figures, but they're dealing with the same legal issues because they haven't used the right legal tools to secure their foundation and to also grow effectively. They just don't know how to grow. They think that a lot of things are illegal that actually aren't. So anyway, in order to grow as a medical spa, you need to be good at marketing. But in order to be good at marketing in the medical spa industry, there are a lot of legal rules that don't apply to other industries, like an e-commerce business or even a car dealership, and all sorts of other professionals that do apply to medical professionals, like soliciting patients and fee splitting and paying referral fees. They may not necessarily work or be legal in a medical spa. And the reason why that's important is because not only are we trying to grow a successful business and stay out of trouble, somebody's professional license is on the line in a medical spa. They may be the medical director that's a little removed from the situation, but having your professional license on the line is a big deal. That's your livelihood. It's your ability to, effectively provide for yourself. So that's not something that you want to run afoul of the rules and, get a fine or get a disciplinary action. It's a big deal. It affects both the medical spa and all of the individuals at their individual license level. So for growth, the medical spas that do it best know all of the legal tools and I'm not going to call them loopholes, because it's just having a sophisticated knowledge of what you can and can't do, similar to tax rules, paying the legal minimum. When I heard that, when I first started paying my taxes, I was like, oh, that sounds like illegal, paying the legal minimum, that's the ick. But ultimately, the IRS and tax code has been written by small business owners for small business owners. And so what I used to call a loophole, I now consider an opportunity. And if I don't use that opportunity, someone else will. It's the same for med spa legal tools for growth. the medical spas that know how to incentivize their patients. They know how to incentivize referrals. They know how to create membership programs with reoccurring revenue. They know how to use all of the tools in terms of their marketing that's already out there on social media or ads, Google ads, without going overboard. The ones that are just kind of, they know exactly what the limit is and they just compete just a tiny bit below it. Those are the ones that do well. And really teaming up with an attorney that can actually summarize federal, state law, and just tell you what the answers already are is going to be a game changer. I wish more people would engage me to do this so that I could enable their growth. All right, next, we're going to move into the key resources that I'm going to provide to you. But first, let's have a word from our sponsor, who I am 100% affiliated with unapologetically.
If you're a healthcare professional looking to launch or grow your medical spa or expand your healthcare services, you need more than just legal support. You need a law firm that understands the unique challenges of entrepreneurship in healthcare. That's where Holt Law does their best work. Navigating the legal landscape can feel complex and overwhelming, and with other law firms, pricing can at times feel like a black box. With Holt Law, not only can you trust their expertise to guide you through the process, ensuring compliance and providing you with the confidence to grow your business, but you can rest easy knowing they'll do it with transparent pricing. But don't just take our word for it. Holt Law has more than 200 positive Google reviews from clients like you who have benefited from their services. Visit www.djholtlaw.com to schedule a free consultation today and let Holt Law handle the legal details so you can focus on delivering top quality care to your clients.
All right, now I'm going to share 2 resources with you that I want you to take advantage of. The first one is a downloadable legal checklist for starting a medical spa, step by step, covering the essential requirements. I put a lot of time into this, and I think it's going to cover a lot of the things that were on this episode in a nice little written fashion. With that, it may pique your curiosity, and maybe you're not a DIY person. That's okay. I am sometimes, and I'm not others. The other resource I want to give to you is we do have free consultations with Holt Law, where we will listen to the challenges that you're facing and try to solve them and see if we can't put a flat fee package on what it's worth for value. So a free legal consultation and the downloadable checklist. Skip both of those. Take advantage of them. Please do. Okay, so in closing here, let's transition and think about what we talked about. So first, the wellness, the med spa industry is booming. It's really growing out of control. In fact, honestly, if I wasn't practicing law, I'd probably be involved in some sort of business facet of a medical spa if I had to switch careers right now, to be honest, just based on what I've seen. So medical spa industry is booming. There's a lot of reasons for that we went over. Second, we talked about some of the legal foundation. A lot of those are going to be summarized in the checklist, the entity choice, the likely one, some of the key legal documents, insurance requirements, and where most of our focus is just at a high level from a legal perspective. And then we transitioned a little bit into the growth. And I really want you to take advantage of sound legal advice. I don't care if it's me or somewhere else or you're on, however, sound legal advice for what you can and can't do in terms of marketing for legal growth for a medical spa. Hinted at some of those, can certainly work with you to flesh all of those out for your specific situation in your medical spa. I believe personally, I really want to emphasize this, that the U.S. healthcare system's broken. That's no secret. That's not my novel thought here. It is that small healthcare providers like yourself and medical entrepreneurs are actually one of the biggest solutions, and especially ones that politicians do not talk about, for helping the U.S. healthcare system have better patient outcomes. Why? It's because small healthcare providers and businesses and medical entrepreneurs are those that invest in their patients, know their patient's name, are invested in the patient outcomes, and therefore care a little bit more, I would say, than your big healthcare, your consolidated 6-minute visits and, write 5 prescriptions. And so I think we need more small healthcare providers coming into the system. I take no opinion on single payer, free markets. I think the most underutilized thing that we are not talking about is more small medical entrepreneurs coming into the system. I will leave it at that. With that, we're going to close, and I want you to take advantage of a free consult with me. We'll see you on the next episode. Thank you.